Good afternoon, everyone, and welcome to our daily COVID-19 update briefing. Dr. Ezike and I are joined today by Dr. Emily Landon, the Executive Medical Director of Infection Prevention and Control at University of Chicago Medicine. Dr. Landon has joined me today to recenter our conversation on what matters most, the health of our people and the trends that are moving that health in a precarious direction. As more and more of our regions see upward movement that requires additional intervention, I've made it a point to illustrate exactly what kind of concerning scale we're seeing compared to previous months of this pandemic. Today, I want to do the same on a statewide level, because statewide, we have a real problem on our hands and people's lives hang in the balance. Let me start with leading indicators. We are seeing substantially more confirmed cases right now than we ever saw in the spring. Since the beginning of October alone, new cases are up more than 150%. The highest 7-day average number of cases we reached in one day in the spring was 2,565 in early May. That came down to about 590 in mid-June. Today, we are at a new high, a 7-day average of 5,043 new cases per day, closing in on twice what we saw in May. Today alone, we're reporting 6,363 cases. We're able to test far more people than we did in the spring, which is very helpful for detecting new cases. But let me be clear, our cases are rising at a much faster clip than our testing. We're now averaging more than 73,000 COVID-19 tests per day. Today, for example, we are reporting more than 83,000 tests. We're the best testing state in the Midwest, and it's not even close. In Cook County alone, we produce more test results per day than 37 individual states do, and more than half of our country. Even as our testing has grown, between late June and late July, our case positivity stayed steady between 2.5 and 3%. From late July to a few weeks ago, it stayed more or less below 4.5%. Today, it's up to 6.9%. And our current test positivity average, which we use for mitigation decisions, is 8.2%. The growth rates that we're seeing in positivity rates, hospitalizations, and deaths are telling us that we are again experiencing a meaningful and sustained increase in transmission of this virus. Our positivity rates alone are cause for action, but our challenges don't end there. Broadly speaking, hospitalizations are a lagging indicator of rising community spread. It could take days or even a week after a positive COVID-19 test for a person to require hospitalization, while others might receive a confirmation of their positive test when already in the emergency room, possibly struggling to breathe. Since the beginning of October alone, statewide, the number of Illinoisans in the hospital with COVID-19 has grown 73%. Let me repeat that. Since the beginning of October alone, statewide, the number of Illinoisans in the hospital with COVID-19 has grown 73%. We came into this month with an average of 1,570 patients in the hospital fighting COVID-19. Today, hardly 4 weeks later, that average is up to 2,700 and growing. There are some individuals who think that we've solved the COVID-19 crisis by developing some treatments for those who have already entered the hospital. But when you look at the actual lived experiences of people who require hospitalization, that statement just doesn't really pan out. In the same time that hospitalizations have grown by 73% across our state, The number of patients requiring admittance into the intensive care unit is up 61%. Lower, yes, but not a gap that anyone should start betting their life on. On October 1st, we were averaging 360 people in the ICU, COVID-19 patients in the ICU statewide. Today, there are over 580 in the ICU. Let's not forget ventilators, which, as any of the doctors standing behind me can tell you, is not a place that anyone ever wants to be. Too many patients who end up on a ventilator do not come back. They just don't. And here in Illinois, similar to ICU patients, the number of patients on a ventilator is soaring, up 61% since October 1st. Tragically, we aren't going to be able to save everyone from this pandemic, but we are doing our best to save as many people as we can by lowering the rate of spread in the community, which will not only allow more kids to go to school and more businesses to operate safely, but also will improve our ability to keep Illinoisans healthy. Those should be the goals that we can all get behind. Deaths are a lagging indicator, and we can see in these numbers the consequences of rising case rates and hospitalizations and ICUs and ventilators across our state from weeks ago. And unfortunately, I'm afraid we can expect worse to come. Deaths from COVID-19 are up 82% since the beginning of October, when we were averaging 23 lives lost each day, now at 41 lives lost each day. That means that every day we are averaging another 41 mothers and fathers, children, grandparents, no longer with us, adding to the total of Illinoisans lost, now approaching 10,000, and the number of Americans lost, now more than 230,000. I know that the vast majority of people in this state are all in on the fight against this virus, just as they fight against the other battles, or fight the other battles, against things that take too many lives, like car accidents and cancer, by wearing seatbelts, by not smoking on planes, by getting a flu shot, by smearing sunscreen across your children's faces in the summer heat, by running the race for the cure, by learning and adapting our lives so that we can all live. I know that the vast majority of people in this state want to keep themselves safe, keep their families safe, keep their children safe, their parents, their neighbors, their friends. Unfortunately, as these trends indicate, things are moving in a bad direction all across our state. And as of this morning, Region 3, which encompasses Quincy, Springfield, and much of west central Illinois, has now sustained an average positivity rate of 8% or higher for 3 days in a row, today hitting 8.8%, meaning that starting Sunday, they will join the majority of the state in operating under resurgence mitigations. That's up from 4.6% in mid-September, the summer peak of 6.2% in mid-August, and the all-time low of 0.9% in mid-June. And the region's COVID-related hospital admissions today have tripled since early September, something that has got to change. And these mitigations aim to cut down on those high-risk activities until we bring down the positivity rate in an area once again. In the meantime, we're upping our testing support with a new mobile site, setting up at the Sangamon County Health Department Saturday through Tuesday, with more to come in that region. As for our remaining regions that are free of resurgence mitigation measures, Region 6 has now seen 2 days in a row of a positivity rate reaching 8%, meaning that a third day, tomorrow possibly, would equal new mitigations in that region. Region 2, which stretches from Kendall County to Rock Island County and includes Peoria, remains the sole region of the state with a positivity average below 8%. But at 7.9% and growing, that might not be the case for very long. We're ensuring testing availability there too, with Region 6 seeing mobile testing in Ford County today, in Richland County tomorrow, Effingham on Sunday, and in Macon at Decatur Civic Center today through Sunday and next week. Region 6 will have a testing site from Monday the 2nd through Sunday the 8th at Danville Area Community College. And in Region 2, Peoria has mobile testing today and tomorrow, and Knox County and Rock Island counties will have sites on Saturday and Sunday. Find the nearest site near you. It's easy. Just go online to dph.illinois.gov/testing. Before I turn the podium over, let me just say this. All of the data that I walked through today is present every day on our DPH website. It's updated every single day, both statewide and by region, so that people across the state can use it to make decisions for themselves and their families about what more they can do to keep each other safe. And not just on the individual level. Across the state, local health departments, hospital systems, and community leaders can and should engage with this data, analyzing it and asking questions and using it to protect their communities. Because let's be clear, well-meaning and reasonable people can have fair disagreements about how and where to draw lines and connect dots, but when every single metric in every single corner of our state is trending poorly, we have to take meaningful action to keep our people safe. And with that, I'd like to turn it over to our Director of the Department of Public Health, Dr. Ngozi Ezike. Doctor.
Thank you, Governor. Thank you for laying that out so clearly, and thank you for your tireless efforts. Let me get straight to the numbers. I think many of them the Governor has shared. In the past 24 hours, more than 83,000 tests were reported for a total of nearly 7.5 million total tests. Today, again, we are reporting 6,363 new cases of COVID-19 for a total of 395,458 cases. Since yesterday, we have been notified of an additional 56 lives lost, again, for a total for Illinois of 9,675. In the hospitals, overnight, we had 3,030 individuals. Of those, 643 patients were in the ICU and 269 were on ventilators. Our entire mission during this pandemic is to reduce the number of cases, to reduce the number of hospitalizations, and reduce the deaths. One way to do that is through contact tracing. Since the first case of COVID-19 was reported in Illinois, contact tracing has been conducted. That's how we knew that our first case had returned from Wuhan. That's how we knew that the second case was in fact the spouse of the first. Public health officials across the state, across the country, across the world conduct contact tracing on a daily basis. It's what we do for measles, for tuberculosis, many other diseases, and of course now COVID-19. It is something that we've always done and we continue to do on a daily basis. We collect this information so that we can help prevent additional cases. The quicker we're able to identify individuals who have been exposed, the quicker we can have them self-quarantine and thereby interrupt disease transmission, hopefully preventing additional people from being exposed to the virus. Because of the sheer volume of cases, again, over 6,300 cases were identified just over the last 24 hours. Almost 400,000 cases in total. Local health departments across the state are hiring and training more and more contact tracers. But again, as these numbers surge, public health is being stretched very thin, even as we bring the new contact tracers on board. When this happens, the contact tracer may not have the opportunity to follow up with every case for further clarification about where they visited in the weeks prior to being diagnosed and who exactly they were with after. We are doing our best to collect as much information as possible so that we can have the most complete picture of where COVID-19 is spreading. But of course, we can't do that without your participation. We're hearing from the local health departments and the contact tracers every day that some people won't answer the phone. And if they do answer the phone, they don't give the answers to the questions. There's also a number that's provided to call back, and often no call back. Please, if a contact tracer calls you, answer the phone. Please give as much information as you can. Public health officials can only track information that we're actually given. We can only share information that we have. So please make sure to provide as much information as you can so that we can absolutely slow down the spread of this virus. Contact tracers are required to keep private health information confidential. We will not give your name to anyone. They will simply indicate to the individual that may have been exposed that they have been in close contact with someone who tested positive and that they would need to quarantine. I imagine that once someone identifies themselves as a case, they probably will do the same thing and start notifying those that they're aware of. This information and letting the contact tracers know and people reaching out to people they may have been in contact with will slow the spread. So please, again, wear your mask, wash your hands, and watch your distance. And of course, also get your flu shot. I have already gotten reports of individuals with both flu and COVID at the same time. We don't want to battle this twindemic at the same time with the same number of hospital beds. And please, if you get that call from the contact tracers, please answer the phone and please share the required information. Thank you.